Hello and welcome to a low pressure approach to controlling high blood pressure. My name is Robina Montague. I am an RN and a practice transformation specialist at Quality Insights. I'm here to introduce to you today an exciting program from the Delaware Division of Public Health, the Delaware Healthy Heart Ambassador Blood Pressure Self-Monitoring Program. After the presentation, you'll have an understanding of how the Healthy Heart Ambassador Blood Pressure Self-Monitoring Program works, including the various components that contribute to blood pressure control. I will provide an overview of the evidence supporting self-measurement of blood pressure as a key tool for hypertension control. And you'll know how you can get engaged in the Healthy Heart Ambassador Blood Pressure Self-Monitoring Program. Quality Insights is a nonprofit organization focused on improving healthcare quality in the pursuit of better care, smarter spending, and healthier people. We participate in federal and state contracts to improve healthcare quality, such as our partnership with the Delaware Division of Public Health. An important part of this work is providing no-cost assistance to eligible healthcare systems, federally qualified health centers, and independent practices to improve individual patient care and overall population health. In 2019, 36.4%, about 280,000 people in Delaware, age 18 and older, reported they have been told by a healthcare professional that they have high blood pressure. High blood pressure is a major risk factor for both stroke and heart disease. This is concerning because heart disease and stroke are the second and fourth leading causes of death in Delaware. The name of the initiative is quite descriptive. Healthy Heart, which is the goal. Ambassador is someone who promotes an activity. Blood pressure self-monitoring, the evidence-based intervention for controlling high blood pressure. In January 2020, the Centers for Disease Control, CDC, introduced the Healthy Heart Ambassador Blood Pressure Self-Monitoring Program to the state's health departments. Delaware Division of Public Health has been engaged in bringing the program to Delaware since this time. In October of 2020, then Surgeon General Dr. Jerome Adams and the CDC reignited work to control hypertension in the US with a call to action to control hypertension. He discussed the importance of controlling blood pressure for individual patients and for the health of the nation together. He laid out goals and strategies with self-monitoring of blood pressure a key foundation. This further supported the goals and strategies of the Healthy Heart Ambassador Blood Pressure Self-Monitoring Program. In December of 2020, staff from the Division of Public Health in Delaware were trained by CDC as master trainers to facilitate the program launch. The no-cost program offers 4 months of personalized support as well as a blood pressure monitor to participate and achieve hypertension control. Throughout the 4 months, participants are offered bi-weekly virtual coaching sessions, as well as monthly virtual nutrition support and education sessions and virtual live cooking demonstrations. All the touch points are scheduled with enough flexibility to easily meet the participants' busy schedules. Here's an example of the patient information flyer, which describes who is eligible, how the program works, and how people can get connected. Let's review a few blood pressure basics. High blood pressure or hypertension is a condition caused by increased force of blood pushing against the artery walls, making the heart work harder than it should. Many people have risk factors for hypertension, including health conditions, lifestyle risks, and family history or genetics. You can see that some risk factors are modifiable, meaning they can be changed, while others are non-modifiable, meaning we cannot change them. It's important to note that most risk factors are within our control. Even diabetes, which once diagnosed cannot be generally reversed, but can be managed. So people can be empowered to take control of their health to a large extent. And that empowerment is the key to the Healthy Heart Ambassador blood pressure self-monitoring program. As we've seen, hypertension is a problem in Delaware and across the nation. In fact, hypertension rates in the US have been rising steadily over the past decade, with Delaware rates among the highest in the country. In 2019, it was noted that 32.5% of people in the United States had been told that they were diagnosed with hypertension. However, recently statistics came out and to support that nearly half of the adults in the United States, approximately 47% or 116 million people, have hypertension, which is defined as a systolic blood pressure greater than 130 millimeters of mercury, or a diastolic blood pressure greater than 80 millimeters of mercury, or are taking medication for their diagnosed hypertension. Hypertension is a concern across all demographics. This slide examines the prevalence of hypertension by gender, age, and race ethnicity. Both men and women are affected, with no statistically significant differences. In 2019, African American adults, approximately 42.1%, had a slightly higher prevalence of reported hypertension than non-Hispanic white adults, which was about 38.4%. Hypertension prevalence increases with age. Over 61% of adults aged 65 years or greater reported having been told of a hypertension diagnosis. But even younger people, especially those with risk factors we've seen, can have blood pressure concerns. 15.9% of those 18 to 44, 38.7% of people 45 to 54, 49.8% of adults 55 to 64, and again, 61.2% of those age 65 or older have been told of a hypertension diagnosis. In this time of COVID, the short-term effects of hypertension must be discussed along with the long-term risks. Recent evidence shows that people with uncontrolled or untreated high blood pressure may be at risk of severe illness with COVID. They may also be at greater risk of complications of COVID-19 than those whose hypertension is managed with medication and lifestyle changes. This is another very important reason for getting blood pressure under control. When blood pressure remains high over extended periods of time, it can damage the heart and cause other health problems. Hypertension is known as the silent killer because there usually are no symptoms. In rare cases, it can cause headaches and vomiting. The only way to know someone has hypertension is to consistently measure blood pressure over time. Because hypertension often has no obvious symptoms and can take a long time to develop, people are often unaware of it, or they don't realize how it affects their body. As I've noted, heart disease is a long-term effect of hypertension, as is stroke, but the risks go even beyond those. This picture shows the other kinds of health problems that hypertension can cause, such as kidney disease and failure, peripheral artery disease, and cognitive decline, and even more things. People with uncontrolled high blood pressure are 4 times more likely to die from a stroke and 3 times more likely to die from heart disease compared to people whose blood pressure is under control. That's about 1,000 deaths in the US per day in which high blood pressure is a factor. If you're a healthcare professional, you realize the challenges of helping patients understand the risks of uncontrolled high blood pressure. If you're a patient, you may have previously wondered why blood pressure is such a big deal. All these complications are serious and real, but they can be avoided by keeping blood pressure under control. But only about half of people with hypertension have their condition under control. That translates into a lot of people walking around at high risk of heart disease, stroke, and more. These are our friends, our family, patients, people we work with, people we care about, or even ourselves. Uncontrolled high blood pressure is a serious problem, but one that can be resolved. The community, the state, the nation are affected too by loss of productivity and increased burden on health systems. High blood pressure costs the United States more than $131 billion each year. That sounds like a lot of bad news, but the good news is that hypertension can be managed, and scientists and doctors understand how. In Delaware, the Healthy Heart Ambassador blood pressure self-monitoring program applies this knowledge to help people control their hypertension. Let's talk about how the Healthy Heart Ambassador blood pressure self-monitoring program works. First, it is a no-cost 4-month program that combines evidence-based self-monitoring of blood pressure with regular coaching and support, plus nutrition education and more. The goal is to empower participants to take control of their blood pressure and manage it through regular self-monitoring and heart-healthy activities. The Healthy Heart Ambassador blood pressure self-monitoring program will help people manage and understand their blood pressure, measure and track it from home, set and achieve health goals, identify and control triggers that can raise their blood pressure. The program facilitators help participants set the goals, adopt healthier eating habits, and increase physical activity. The program will provide the equipment, tools, and knowledge needed to succeed. So how does it work? The program is being held virtually so participants can engage in the program in the comfort of their homes via Zoom. The program includes scheduled bi-weekly personal consultations with a program facilitator and monthly nutrition education seminars. The foundation of the Healthy Heart Ambassador blood pressure self-monitoring program is blood pressure self-monitoring, which is when people regularly use a home blood pressure monitor to take their own measurements. Sharing blood pressure trends over time gives healthcare providers powerful information to tailor care plans for individual patients. Strong scientific evidence shows that blood pressure self-monitoring plus clinical support helps people with hypertension lower their blood pressure. Clinical support includes regular appointments that you receive from your healthcare provider, education, support, and pharmacological and non-pharmacological recommendations. The non-pharmacological lifestyle change program, the Healthy Heart Ambassador blood pressure self-monitoring program, is one of the recommended lifestyle change programs. With a strong scientific evidence base, blood pressure self-monitoring is recommended by the National Million Hearts Initiative, the Agency for Healthcare Research and Quality, the United States Preventative Services Task Force, and is promoted by the Centers for Disease Control and Prevention as a best practice. It has been shown in multiple studies to effectively promote statistically significant decreases in the systolic and diastolic blood pressure, particularly when combined with clinical support and team-based care. The idea of taking their blood pressure at home is new to many people, and it is normal to wonder why it's important. People may wonder if they can use the equipment properly, or if home monitoring will require a lot of time. Studies show that some people have elevated blood pressure readings in the office, but their blood pressure measures are normal at home over a period of time. Those people may have what is known as white coat hypertension. This is where the environment of the doctor's office creates enough discomfort to raise their blood pressure, even if they don't seem to be outwardly anxious. Or perhaps they're having a busy day or got stuck in traffic and rushed to the clinic, enough to raise their blood pressure. The provider needs an accurate understanding of the patient's blood pressure. Other people may have undiagnosed hypertension. They may have slightly elevated blood pressure in the provider's office, and the provider wants to track it over time to see if the patient really has hypertension. Or they may have normal readings in the office, but elevated blood pressure taken elsewhere. Either way, it is important to know what the person's blood pressure really is, so the healthcare team can determine what is the best treatment plan. Participants in the Healthy Heart Ambassador blood pressure self-monitoring program will receive at no cost a validated Bluetooth-enabled on-run blood pressure cuff. If they do not already own an appropriate cuff, this is provided for them. The health coaches will ensure that participants are confident and comfortable with the correct use of the equipment and have a plan for tracking and communicating their blood pressure measurements. The Healthy Heart Ambassador blood pressure self-monitoring program will teach people about healthy eating, such as the DASH diet. DASH stands for Dietary Approaches to Stop Hypertension. DASH has been proven for over 20 years. Studies show that following DASH and eating less sodium can help lower blood pressure and LDL cholesterol. Participants will learn more about DASH eating plan and why it works. As a bonus, there will also be live virtual cooking demonstrations during the program to help participants build confidence in creating heart-healthy meals at home. Throughout the program, participants are offered educational topics such as medication therapy management, know your numbers, and more. The program welcome package includes an activity measurement device, such as a Bluetooth-enabled pedometer, to encourage participants to increase activity. Hopefully by now you've learned enough about the Healthy Heart Ambassador blood pressure self-monitoring program that you want to refer your patients or participate yourself. Who is eligible for this free program? Participants must live in Delaware and be over 18 years old. They must have been diagnosed with hypertension or prescribed a medication for hypertension. Those who have had a cardiac event in the previous 1 year, have AFib or other arrhythmias, or are at risk for lymphedema are not eligible. If you are unsure if you're eligible or not, please call or email any questions you may have. The program facilitators will screen as part of the registration process, and patients will be referred back to their healthcare provider if clarification or approval is needed. If you are a patient, consider joining the Healthy Heart Ambassador blood pressure self-monitoring program as an investment in your health and a commitment to reducing your risk for heart attack or stroke. One of the benefits of the program is the support you will receive to develop the habit of self-monitoring to lower or better manage your blood pressure. Participants can self-refer and register directly at the contact information shown here. If you are a provider, the Healthy Heart Ambassador blood pressure self-monitoring program can extend your medical care from the clinic to the community. This program will enhance the education you provide and help you tailor your care plans to help patients achieve blood pressure control. As a bonus, higher rates of hypertension control will help your practice's clinical quality measures. While patients can self-refer to the program, we know that recommendations from trusted providers are powerful and highly influential. And we hope that you will talk to your patients and encourage them to participate. The Healthy Heart Ambassador blood pressure self-monitoring program is designed to make referrals easy and convenient. In addition to direct referral of individual patients, there are several referral pathway options that allow you to use your electronic health record to efficiently reach eligible patients. Assistance is available with patient identification and outreach on behalf of your practice through letters, portal messages, or text messaging, all with follow-up phone calls to respond to your patient's questions and concerns. All you need to do is reach out to your Quality Insights Practice Transformation Specialist. The Surgeon General Report and CDC remind us if we all take action and make blood pressure control a priority, we can do great things. Whether you are a patient, community member, or healthcare professional, Please share this opportunity with everyone you know. Together, we can effectively reduce blood pressure and the associated risk of heart attack and stroke. Working in unity, we can build a safer tomorrow. We can control hypertension for better health. In Delaware, an important way to take action together is to participate in the Healthy Heart Ambassador Blood Pressure Self-Monitoring Program. Make the investment in your health and your patients' outcomes. Classes are forming now. Patients, talk to your doctors and get enrolled. Providers, select the referral pathway most suitable for your practice. Contact your Quality Insights Practice Transformation Specialist for assistance with an efficient, effective way to refer appropriate people. At Quality Insights, we promote education and implementation of best practices, including evidence-based therapeutic lifestyle interventions, such as the Healthy Heart Ambassador Blood Pressure Self-Monitoring Program. The result will be improved quality performance for providers and practices and better health for Delawareans. If you're a provider or practice, we want to know how we can help your practice. We can assist with workflow modifications to identify eligible patients, as well as providing outreach by letter, text, or patient portal message with follow-up phone calls to answer questions on behalf of your practice. We also invite you to visit our website, where you will find resources on hypertension and beyond. Thank you for taking the time to listen and learn about the Healthy Heart Ambassador Program. My name is Robina Montague, and right above my name and contact information is the link to our Improve website, where we can work with you to help improve the care that you give to your patients. Thank you and have a great day.